Hello, world and universe. Welcome to the Trevor Donald Experience. Manifest your truth. And if you're new to the channel, please hit that like and subscribe button. And for all my continued followers, I want to say thank you. And this is an opinion-based video channel where I try to open your eyes and ears up to some of the travails and tribulations that take place throughout our cities, our states, our country, and sometimes around the world. And this particular story has to deal with our entire country, where President Trump and his administration is trying to limit the use of what you can do with your SNAP benefits or food stamps as far as what you can buy. And they're trying to remove junk food from you being able to buy on food stamps. And that begs the question, is that a violation of our civil liberties for those who have food stamps? So you're talking about President Trump and the Department of HHS, which is Health and Human Services, under Secretary Robert F. Kennedy. SNAP stands for Supplemental Nutrition Assistance Program, in other words, or AKA food stamps. And you got to remember, this is in alignment with Medicaid. As I previously noted in a video, that under that big beautiful bill, President Trump is on this pugnacious rage of reducing government waste, and he's talking about he got passed and was talking about Medicaid cuts for recipients. Somewhere in the alignment of 11.8 million folks will end up losing their Medicaid benefits. And remember, Medicaid and food stamps are for low income or no income individuals who need help medically and with food. So 11.8 million is going to be teetered over a number of years by the time Trump leaves his administration. And that is 1 in 5, 20% reduction in people that will be able to utilize Medicaid or are going to get cut off. Also, when it comes to SNAP benefits, there's something like 40 million people across our country that utilize food stamps, and there's going to be a reduction of about 8.5 million recipients or people that have had food stamps that won't be able to get them. That's a 20% reduction. So there's going to be a definite effect with these Medicaid cuts on how hospitals, urgent cares, assisted living, residential care facilities, nursing homes are going to be affected by these Medicare and Medicaid cuts. And under this big beautiful bill, remember, not only President Trump, but the Congress and the Senate approved it. The big beautiful bill. So there is going to be a gut-wrenching punch that is going to affect low-income individuals. And now his administration is talking about limiting how you can spend your SNAP or food stamp benefits. And they're trying to remove junk food, which I think is a good thing. But it does teeter on, is this a violation of one's civil liberties? So let's get into it. And once it starts in one state, it will have a overflow into other states. And right now, 6 more states ban junk food from SNAP benefits. 6 more states have banned junk food purchases from being bought with Supplemental Nutrition Assistance Program, SNAP benefits. The U.S. Department of Agriculture, USDA, has announced West Virginia, Florida, Colorado, Louisiana, Oklahoma, and Texas have all had new waivers approved that allow each state to modify what can and cannot be bought using food stamps. Across all of these states, the change will impact approximately 8.5 million people. It brings the total number of states banning junk food purchases to 12 out of the 50 states, following similar waiver approvals earlier this year for Arkansas, Idaho, Indiana, Iowa, Nebraska, and Utah. So if you live in any of those states that I just mentioned, there is going to be a limitation on you being able to utilize your SNAP benefits for junk food. Why does it matter? SNAP benefits, also known as food stamps, are paid to low and no income households across the United States that would otherwise struggle to afford groceries. Across the country, more than 40 million people, 40 million, receive this allowance. What to know about it? A waiver grants flexibility to modifying specific USDA program rules, enabling states to administer the SNAP program in different ways. Various states currently have SNAP waivers in place, and they were widely implemented during COVID-19 pandemic to help Americans get better access to food benefits. The new waivers, while different for each state, mean that starting in 2026, certain types of food can no longer be bought using electronic benefit transfer cards, which are loaded every month with payments to spend in participating grocery providers across the country. Junk food generally refers to foods that have lots of calories, particularly those high in micronutrients such as sugar and fat. But they have little nutritional value. In Texas, the ban will cover soda, energy drinks, candy, and prepared desserts, while in Louisiana, soft drinks, energy drinks, and candy will be banned. Some of the waivers are less restrictive. In Colorado and West Virginia, only soft drinks will no longer be eligible for purchase. So here are some of the other states banning SNAP junk food purchases. And for example, Arkansas, which will take effect in July 1st, 2026, restricts purchases of soda, fruit, and vegetable drinks with less than 50% natural juice, unhealthy drinks, and candy. Florida, which will take effect in January 1 of 26, restricts purchases of soda, energy drinks, candy, and prepared desserts. Idaho, for example, will start going into effect on January 1st, 2026, restricts purchases of soda and candy. In Texas, April 1st, 2026, restricts purchases of sweetened drinks and candy. In Indiana, which goes into effect January 1, 2026, those SNAP benefits will be restricted by purchases of soft drinks and candy. In Oklahoma, on January 1st, 2026, SNAP benefits will be restricted from purchases of soft drinks and candy. This push to tighten rules around unhealthy purchases has been led by Republican states, with Colorado being the only Democratic state to join the throng. Proponents of limiting SNAP purchases have argued that removing unhealthy foods from the program will improve health conditions, while others have argued that it controls how America's poorest people eat and fails to address wider problems regarding access to affordable, healthy foods. So we should allow folks to eat unhealthy food, increase their chances for diabetes, cancer, high blood pressure, cancer, and all those kinds of things. Mind you, if we don't limit and restrict some of these unhealthy foods, and the increase for unhealthy human beings will go up. But then the third part of it, President Trump is talking about cutting almost 12 million people off of Medicaid here in the near future. So these people will be eating unhealthy, won't have medical care, and what is going to happen to almost a 20% population while he's trying to save $1 trillion from the Medicaid cuts. What are people saying? Health and Human Services Secretary Robert F. Kennedy said for years, SNAP has used taxpayer dollars to fund soda and candy, products that fuel America's diabetes and chronic disease epidemics, which is what I just said. But there's a duality here because providing SNAP to folks, which the taxpayers, which we are paying for, and then limiting their access to what they can and cannot buy, has some constitutional issues that are aligned with it. Is that a violation of one's civil liberties where the government is doing too much and telling you what you can and cannot eat? Are we headed in that direction? These waivers help put real food back at the center of the program and empower states to lead to change in protecting public health. I thank the governors who have stepped up to these request waivers, and I encourage others to follow their lead. This is how we make America healthy again. That's what HHS Robert F. Kennedy said. Texas Governor Greg Abbott said to ensure the health and well-being of Texans, we must promote better, healthier food habits. Earlier this year, I requested a waiver from the USDA to ensure SNAP benefits cannot be used to purchase junk food. I applaud Agricultural Secretary Brooke L. Rollins and the Trump administration for their approval of this waiver to support and promote healthy eating habits. The state of Texas will continue to consider innovative ways for Texans to lead a healthy and productive life. Cavell Christie, a health policy and advocacy expert and director at the Center for Regulatory Policy and Health Innovation, previously told Newsweek, this issue isn't about individuals misusing their benefits, but their limited choices. In many rural areas and food deserts, which you see in many urban cities, convenience stores and fast food chains are often the only available options. Well, that's a double entendre. Yes, that may be true about convenience stores, but you can't use SNAP or food stamps to go to fast food chains. You can't buy hot food with food stamps. So that's irrelevant when this person says that they have limited access. Well, whatever access they have, I do believe that a person that's on food stamps should only be buying healthy food. I've seen too many times in the city of Chicago and St. Louis where these mothers are going to these gas stations and buying innumerable amounts of junk food for their children and themselves. So I think the taxpayers we all help provide this service to help low income and no income individuals to get food, but they should be geared toward buying healthy food and not snack food, potato chips, candy. That is doing a disservice to the health and welfare of our society. For many families, fresh food and healthy meals are luxuries that are unattainable, not because they do not want these foods, but because they are unavailable or too expensive. I don't agree with that. You can drive all around the cities. People are able to move around through public transportation, through their own vehicles or somebody taking them. They go to Schnucks, they go to Deerbergs, everywhere these grocery stores accept food stamps, and people are making a conscious choice whether they want to buy healthy food or unhealthy food. I don't believe that it's due to a food desert or limited access. A food desert refers to an area, usually a low-income community or an urban area in the inner city, where residents have limited access to affordable and nutritious food, particularly fresh fruits and vegetables. Well, you have places like Save-A-Lot, Aldi's, that are all in these inner city urban markets, and they're accessible through public transportation, and people can get access to healthy food. I disagree with that 100%. So what happens next? Each of the waivers will go into effect in 2026. That's next year, meaning there will be no immediate changes for SNAP benefits across the impacted states for now. But remember, It's almost September. This is mid-August. These next 4 or 5 months and the year 2026 is right around the corner. Most come into effect early next year. So, what are some of the issues there? As I said, President Trump is talking about cutting out 11.8 million people for Medicaid. Many times people that have Medicaid, they're in alignment for food stamp eligibility and benefits. And with Trump, with this big, beautiful bill, he wants to cut out 12 million people from receiving Medicaid benefits, which the taxpayers we pay for. I disagree with that wholeheartedly. Congress and the Senate did approve it, this big, beautiful bill. And as a result, you're talking about 1 in 5 individuals, 20% of our current market, as far as Medicaid recipients, will lose their Medicaid benefits. And if they lose their Medicaid benefits, they're going to lose their SNAP benefits. Well, before you even get to that, they're talking about now limiting what you can do or what purchases you can make with your SNAP benefits. And this is going to affect about 8.5 million people out of the 40 million people that receive SNAP. That's over 21% of the populace that utilizes SNAP benefits will be affected. And you have something like 12 states that are in alignment with the HHS Secretary Robert F. Kennedy, who wants to build, or his claims are to build a healthier society. I agree that if you are using SNAP and or food stamps, it should be for a completely healthy purpose. I am not in alignment with people using their SNAP benefits to buy junk food. But there is a fine line between our government coming into our households, coming into our wallet, and telling us what we can and cannot do. There might be some issues of how this affects our civil liberties under our United States Constitution. But it looks like this is going into effect. I've seen it personally where folks have brought their kids in or them individually, and they buy hundreds of dollars worth of junk food, which to me serves no purpose, is unhealthy. I think it will increase the opportunities for diabetes, high blood pressure, cancer, arterial clog. And so, yes, we need to have a much healthier society. I don't believe that the reason people are buying junk food is because they live in a food desert or a rural area. This is 2025. People have access to be able to move around for the things that they want to move around for. And having the right appropriation for buying the right kinds of food to live a healthy society is at a premium. We need healthy people to live in a healthy society. Tell me what you think about President Trump and the HHS, Health and Human Services Secretary Robert Kennedy, trying to ban people that utilize SNAP benefits from buying junk food. And it is already in alignment where 12 states have accepted this regulatory mandate that will go in effect in 2026, where people who receive SNAP benefits will not be able to buy certain kinds of junk food, such as soft drinks, desserts, candy, and those with that kind of nature. Tell me what you think. This has been a Trevor Donald Experience. Manifest your truth.